Good morning, everybody. Functional medicine looks at root causes of chronic disease and tries to prevent them in the first place. And nowhere is that more relevant than in thyroid dysfunction, which really affects probably 50% of women over the age of 40. So we have a nice cloudy day in Boonville. Tammy Crabtree got me thinking about this as she's been talking about thyroid testing and recommendations for thyroid testing. And the vast majority of you that think you may have a thyroid dysfunction may or may not, but you're not going to figure this out with just standard thyroid testing, which frequently is just a TSH or thyroid stimulating hormone level. Some doctors do a T4 level as well. And until I started understanding thyroid more in depth, my standard screen was a TSH and a free T4. Well, that doesn't tell you enough. And you may push and push. You can argue with your allopathic physician and have all the symptoms of thyroid dysfunction, and they will still probably just do a TSH and a T4 level. They may take you to a T4 level, but they're not going to look at a comprehensive thyroid panel. And I'm not suggesting anybody argue with their doctor. I'm saying that there are 5 patterns in thyroid dysfunction that are fairly common that will not be picked up by standard thyroid testing. So accurate diagnosis is essential, right? You've got to figure this out. So, I mean, if you're lethargic, you're fatigued, your hair's falling out, you have bowel dysfunction, you have cold intolerance, you're gaining weight, just look up the 25 symptoms of thyroid dysfunction. And if you think you have them and you cannot either see or afford a functional medicine doctor, or your doctor will not order a full thyroid panel, get in contact with me. I'll find you a doctor that will do it, that will order the correct tests, or you can order them yourself. So misdiagnosis is commonplace in the management of hypothyroidism. So hypothyroidism is clearly more common than hyperthyroidism. I've seen 2 or 3 hyperthyroid people, and I've seen women that were overtreated for thyroid, and they get thyroid elevation, and they get hyperthyroid symptoms. So countless, countless men, and well, women more than men. I haven't seen that many thyroid dysfunction men patients, but thyroid dysfunction in women, like I said, probably half of women over the age of 40. And they're dismissed. You know, they're put on meds. Sometimes they're put on thyroid meds, and that's not the actual thing to do. So functional medicine practitioners, the ones that I work with, are really looking at root causes. They want to either get to you and prevent chronic disease in the first place, looking at your diet and your bowel function and your nutritional intake and vitamins, etc. Or they can reverse that. Most of chronic disease is inflammatory. That's also true for thyroid dysfunction at times. So if your lab values don't fit within a diagnostic criteria that is set by whoever, they're established by labs by standard thyroid panels. And so other people, you know, some people are given prescriptions for thyroid hormone replacement, which is really just throwing a blanket at symptoms, even if you can find someone that will do that, while ignoring the underlying cause of the hypothyroidism. So lots of these don't show up on standard lab tests, and they're unfamiliar to allopathic and conventional doctors, the big box doctors that are following all the recommendations based on, again, a bell curve like I tell you about. So we're going to talk about 5 patterns of thyroid dysfunction missed by standard lab tests and how you can try to get your physician to correct those patterns and restore thyroid health. And if you can't, I'll find you one that will. Okay, so here's the problem. So if you have a laundry list of hypothyroid symptoms, you will probably get a standard thyroid panel, TSH, maybe a T4. But it's problematic. There are several reasons for problems with the standard thyroid panel. First of all, the standard thyroid panel is usually just TSH, possibly a T4 as well. So there's a lot of factors involved in optimum thyroid function. And TSH and T4 don't tell the whole story. And TSH, normal values have been actually downregulated by the National Endocrine Society. So ideally, your TSH would be 2 or less. The standard lab test is about 0.9, 0.8 to 4.5. So if you're 4.5, you're normal, but you're not normal. So to obtain a clearer picture of a patient's thyroid health, a physician has to do additional markers, free T4, free T3, reverse T3, and we'll talk about all these tests here in a minute. And then, of course, the normal ranges for TSH and T4. So number 2 problematic with standard thyroid testing is that the normal values vary by the lab. So I get the benefit of looking at a variety of laboratory normal values from various labs. The two biggies being Quest and LabCorp, but there's plenty of other labs. And so it's an inconsistent range of normal. So the implementation of effective treatment for hypothyroidism or some of these 5 patterns, if you just do a TSH and a total T4, you're not going to get the whole picture anyway. Plus the value changes depending on what lab you use. And so the lab ranges, like all of them, are based on a bell curve, or the Gaussian distribution curve, if you remember 17th century math. Collected from people that are going to labs for testing. And of course, the vast majority of people going to labs for testing have health issues. So that means basically that the normal ranges for TSH and T4 are not based on values to promote optimal health, but rather on a range of values collected from sick people that have health issues. So it's pretty crucial that we use functional ranges rather than standard ranges when assessing thyroid status of patients. And for the most part, your free T3, free T4, T4 and T3 should be in around the 50th percentile. Okay? So there's lots of thyroid dysfunction that's missed because those ranges don't fit on the standard thyroid panel. Okay? So you have to dig deeper and determine whether or not that you are having difficulty with one of these 5 thyroid patterns we're going to talk about. So thyroid physiology, think of the thyroid as the accelerator of your body. It's complex. It's regulated by input from multiple endocrine glands. And remember, hormones and endocrine glands all talk to each other. It all has to be in balance. It involves the immune system. It involves the gut. Lots of cell signaling molecules. And so if there's a malfunction in any one of those components, you can get hypothyroid symptoms. And those are not revealed by a standard thyroid panel. So hypothyroid symptomatic people with a normal TSH and T4 according to standard thyroid panel results are frequently told there's nothing wrong with their thyroid glands, and off they go. They're sent on their way. No treatment, or typically mental health treatment seems to be the biggie. And then some are given prescriptions for thyroid replacement when that might not be the best approach. So it's a one-size-fits-all approach to managing hypothyroidism, and it ignores all the factors that influence thyroid function and can actually worsen symptoms in some patients. So it's a disservice to people that are going to physicians looking for help. And lots of times of these 5 patterns, well, most of the time, they're being missed. So they're being misdiagnosed. So pattern number 1, hypothyroidism from pituitary gland dysfunction. Okay, that's caused by high cortisol levels. And cortisol is elevated in response to active infection, blood sugar abnormalities or dysregulation of blood sugar, hypoglycemia, insulin resistance epidemic. We've been talking about it in class for several weeks. or chronic stress. We talked about that, I think, last week. Or even pregnancy can do that. So these stressors fatigue the pituitary gland, and it's not able to release enough thyroid-stimulating hormone to stimulate the thyroid gland to produce T4 and T3. Those are the two hormones produced from the thyroid gland. So in other words, the gland itself, the thyroid, is fine. The problem's in the pituitary gland. And so the key to correcting that pattern is to resolve the underlying causes of pituitary dysfunction by treating infection, inflammation, balancing blood sugars, improving insulin sensitivity, in other words, reversing insulin resistance, and helping with stress levels. That may be cognitive behavioral therapy, or even identifying the triggers of stress, which takes some depth into medical history taking, right? So these people will present with thyroid symptoms, hypothyroidism. So TSH is below the functional range, so think 2 to 3. And remember, the functional range is about 0.3, 0.4 to about 2, 1.8. So it's in the standard range, 0.5 to 5, according to this article. And then the T4 is in the low functional range and maybe in the low standard range as well. Remember, T4, T3, free T4, free T3 are best at 50th percentile. So if you're in the lower range of that, with a TSH that is is above the functional range, you may have a pituitary problem. And think how common insulin resistance is, like we've been talking about, and think how common chronic stress is. Pattern number 2, under conversion of T4 to T3, important deal. T4 is inactive. It's the inactive form of thyroid hormone. It's 90% of the hormone produced by the thyroid gland, and it has got to be transferred to the cell membrane and converted to T3 before the body can utilize it. So the actual active thyroid hormone is free T3. Okay? And so when T4 is not converted to T3 in adequate amounts, you get symptoms of hypothyroidism. And you wouldn't know that if you haven't measured T4, T3, free T3, free T4. And under conversion of T4 to T3 has lots of underlying causes that need to be addressed. So inflammation, chronic inflammation, the basis of all chronic disease, elevated cortisol levels, nutritional deficiencies, nutrient deficiencies, and intestinal dysbiosis. So chronic gut issues. Those people will present with hypothyroid symptoms and have a normal TSH and T4, but their T3 will be in the low range. Might be low normal, but still low, below that 50th percentile. So 20% of thyroid hormone activation is initiated in the gastrointestinal tract by gut microbiomes, or gut microbes, the microbiome of the gut. So they produce the enzymes that convert T4 to T3, and disruption of the gut microbiota may reduce levels of beneficial bacteria that perform that conversion, resulting in a decreased amount of T3, and again, you get symptoms of hypothyroidism. Okay? T4 to T3 conversion in cell membranes. So chronic inflammation creates production of inflammatory cytokines, which damage cell membranes and then impair that conversion. So chronic fatigue syndrome, or fibromyalgia, the other name for that, and Crohn's disease patients are two examples of that subset who may present with low T3 syndrome due to chronic inflammation of their cell membranes. And so high cortisol, also from chronic inflammation and stress, also suppresses conversion of T4 to T3. And then the nutrient status is essential. So iron and selenium serve as cofactors for the enzymes that convert T4 to T3. And so deficiencies of iron and selenium may reduce that conversion and promote the symptoms of low thyroid. Okay, pattern number 3, hypothyroidism caused by elevated thyroid binding globulin, TBG. So that's the protein that transports thyroid hormone through the blood. And when thyroid hormone is bound, just like testosterone, to sex hormone binding globulin, if thyroid T4 is bound to thyroid binding globulin, it's inactive, it's unavailable to tissues, it cannot bind with the cell wall. And so high levels of TBG reduce levels of free thyroid hormone and give you hypothyroid symptoms. So the lab pattern on this is a normal TSH and T4 with a low T3 and a high T3 uptake, which is a measure of the quantity of the thyroxine binding proteins such as prealbumin and albumin, as well as high thyroid binding globulin. The other thing that can do this is elevated estrogen levels. Okay, so estrogens may be elevated due to use of birth control pills with synthetic ethyl estradiol, and in even women that are on estrogen hormone replacement therapy for perimenopause or menopause. So monitoring estradiol levels is kind of a deal. You've got to do that. It's part of the protocol for monitoring hormone replacement therapy. You don't want this ridiculously high, huge estradiol level, which can cause thyroid dysfunction. So you either have to lower doses. Women that are on birth control pills typically have thyroid dysfunction symptoms and then low testosterone levels as well. So sometimes you have to come up with an alternative form of birth control for those women. Okay, number 4, hypothyroidism caused by decreased thyroid binding globulin. Okay, so low levels of thyroid binding globulin cause free thyroid hormone levels to rise. There's fewer proteins available to bind those hormones, and then the high circulating levels of T4 and T3 induce cellular resistance to thyroid hormone, which is very similar to insulin resistance with carbohydrate loads and blood sugar levels. Insulin resistance from chronically high insulin production and high blood sugar levels. And so the same kind of thing happens with chronic exposure of cell membranes to circulating T4 and T3. So those lab patterns look like normal TSH levels and T4 levels with a high T3 level, a low T3 uptake, and a low TBG level, thyroid binding globulin. The other thing that can cause a decrease in thyroid binding globulin is a high testosterone level. So since we do treat men, of course, with andropause with testosterone, we do have to watch and monitor their thyroid function about once a year. And then for women, usually thyroid tests twice a year. And then we watch testosterone levels pretty close on men and women. So women with polycystic ovary syndrome and insulin resistance, and those go hand in hand, tend to have high androgen levels, some of which is converted to testosterone, so think DHEA levels, and they have to be monitored and worked on for insulin sensitivity. So in other words, getting rid of insulin resistance and watching blood sugar level balance in order to get successful to get rid of their thyroid dysfunction. Okay, the 5th sort of silent pattern of thyroid dysfunction is thyroid resistance. So in this pattern, the thyroid gland and the pituitary gland are functioning normally, but thyroid hormone is unable to get into the cells. So in this pattern, TSH, T4, and T3 levels are normal on lab tests. The problem is we don't have any way of testing, laboratorily wise, thyroid resistance. So how do the hormone receptors on cells, are they resistant? How do they work? Are they resistant to the T4 and T3? That would be helpful. The closest you can come is the Dutch test that we talked about last week, where you're looking at high cortisol and chronic stress levels, as well as assessing the hypothalamic pituitary adrenal axis. That's part of the Dutch test. That's that 24-hour 4 to 5 dried urine specimens sent into a lab, and you get this very detailed report that I put up last week when we talked about the Dutch test. So these 5 patterns not only fail to show up on standard blood work, but they also respond poorly to conventional thyroid hormone replacement. So if you can't convert T4 to T3, has high or low levels of thyroid binding globulin, or has cells that are resistant to thyroid hormone, you can give that patient all the T4 you want, but the body cannot use it. So you have to delve down into the underlying causes of the thyroid dysfunction. So rather than just prescribing thyroid replacement for people who have hypothyroid symptoms, the underlying causes I just delineated for each specific pattern. And so selecting the appropriate lab tests is crucial for functional medicine doctors and functional health coaches like me to piece together the factors that contribute to a thyroid dysfunctional person. Okay, so what are the tests that you should consider? And you can push for these, and like I said, if you can't find a functional medicine doctor who will typically do this anyway, but if you can't, contact me and I'll get you in touch with a functional medicine doctor, or I'll get you the tests that you can do by direct access. So the standard thyroid function panel is insufficient for identifying these 5 patterns. So the additional tests are follows. If you think you have thyroid dysfunction and your doctor's not looking into it, here's what you need to ask for or find a way to do. So a comprehensive thyroid pattern of markers. So TSH, T3 total, T4 total, free T3 and free T4, okay? And then I would also say thyroid binding globulin, thyroid peroxidase antibodies, just to make sure you don't have Hashimoto's thyroiditis, and then reverse T3. So that's the full panel. Let's call it T7, thyroid 7 panel. So a Dutch test, the dried urine test I talked about last week, for assessing hypothalamic pituitary adrenal axis, as well as the hypothalamic pituitary ovarian axis in women, and the gonadal axis in men, testicular function. And that can help you determine whether chronic stress and high cortisol are causing pituitary dysfunction or underconversion of T4 to T3, or may give you the lead into thyroid hormone resistance. And again, hormones: estrogen, progesterone, and testosterone, and DHEA. That helps you determine whether or not elevated or decreased thyroid binding globulin are the cause of your a patient's hypothyroidism. And then a fasting blood sugar, a fasting insulin level, and a hemoglobin A1C level. You need to address sugar imbalances as well as insulin resistance, which contribute to hypothyroidism, also caused by pituitary dysfunction. And then the deficiencies of the nutrients. Measure a serum ferritin level and a serum selenium level. Easy to do. You just have to order it. And then assess gut health. So here's where it gets a little hinky for some people. So there's stool testing. There's some breath testing. Life Extension has a breath test for small intestinal bacterial overgrowth. And then there's urine organic acid profiles that can be used to identify potential gut infections and then disruptions of the gut microbiome that can contribute to hypothyroidism. So that gives you a short 20-25 minute class on 5 hidden patterns of thyroid dysfunction that most conventional allopathic and big box and corporate owned physicians are going to miss, that you can only find by more intense testing. And like I said, if you can't find a functional medicine doctor to do that for you, or who will delve into the underlying causes of hypothyroidism, get in touch with me. I'll link you up with a functional medicine doctor, and I'll get you the lab testing that you need. Okay, that's it for class this morning. I'm operating off of my phone this morning, my little computer. I upgraded, think about this if you're a Mac user, I upgraded to Big Sur, the operating system, and I use a USB Wi-Fi adapter that's not supported with that updated with that updated operating system. So kind of aggravating. I've got to figure out a way to get around that. And they don't have the USB Wi-Fi adapters out on the market for sale that work with big servers. Same thing happened with their 10th operating system update as well. I figured out a way around that one. Now I've got to figure out this one. So have a great day. It is Wednesday. We're halfway through the week. And my high school is out Friday. And then I have the summer off to health coach people, like full-time. So I'll talk to you either tomorrow or Friday. So now I'm going to move my phone. And we'll probably delve into some more strategies for weight loss and managing obesity. Okay, have a great day. See ya. Bye.